So we have a couple of questions from the group. So the first question is something that I think we would be all very interested about. So the question is, are financial matters ever approached with the teens and young adults? I ask because as an older patient or adult patient, I am perpetually drowning in debt with hospital bills. Because I am thankfully quite capable of working and do not qualify for benefits that someone on disability might be. It's a double-edged sword.
I'll start with that, and then I'll have Kim say more. The question: are financial issues ever discussed with the patient? As a social worker, unfortunately, in our healthcare system in the United States, I always initiate those conversations with children at a very young age. That's not ideal, obviously. It's not how we would want to talk about managing their health, but it's the reality. And so I think it's important to speak very clearly, earnestly, and directly with the children about the importance of having insurance coverage, about the challenges of accessing supplies. There are a few different organizations within the United States that have donations for supplies that can sometimes be helpful. There are some institutions, especially academic institutions, that might have some funds to assist people in filling their prescriptions, their supplies, or paying off some of their medical debt. But as this person is illustrating, this is a grave issue and a challenge for a lot of people with bladder exstrophy and chronic illness. And Kim, why don't we have you speak more about that?
Definitely. I will say that I'm only going to speak from personal experience. This is a kind of a realization of a lot of us that are older, that we didn't have the opportunity of camp and making connections. I don't know if I mentioned it. The first BE patient I met was 2 years ago, Thomas. So I'm only going to speak from my own experience. And I believe, which unfortunately for all of you means I came of age in the 80s. So a different experience around insurance. And my parents made it abundantly clear. I had no, college. I had to go to college. I had to get an education so I could get a good job, and that not having insurance was not a possibility. We were middle class, but we always had insurance. And that definitely was a very formative thing for me growing up. Is I can't imagine not having it. So I'm not a great resource for folks who've kind of sort of had to leapfrog between jobs not having it. Worked for a university and right out of college, an academic institution, but I always made sure. Let's see here, I was going to say something else, and I'm very curious to hear from a young adult kind of how you have thought about that, or sort of did your parents talk to you about the money aspect?
Not at all. Not at all. I was super intimidated to navigate the insurance world. And honestly, I still kind of am, but like the hospital social workers have helped me in the past navigate that a little bit. Thank God. I'm a Boston Children's patient myself, and they have an amazing team of like social workers and wraparound care and people that'll help support you in all things, not just the physical medical side. And last time I needed work done up here, it was a huge insurance problem. The insurance changed over like New Year's and I couldn't get it done. And they worked their butts off to help me find care and like combine either shifting insurance policies or finding somebody in my local community that would be covered. But this is a super valid question because this is like one of the most challenging things about the American healthcare system, which, I personally think is like morally evil and corrupt. But that's just me. Just look at these precious babies and imagine telling them no surgery for you, like you're evil. It's a super valid question and concern, and I wish I had like a magical like boop, I fixed it for you, but I don't. It's a true concern.
And I had a similar experience. And I will say, I think Emily, you were talking about starting to talk to kids from a young age about things. And I will say it's a really fine line between, you don't want to make kids feel bad about medical bills. So you definitely don't want to talk to them about them too young. However, at the same time, like for my family, I felt like I turned 18 and it was very, like you said, kind of like overwhelming and traumatizing because it's like suddenly we're talking about all these really scary numbers and big bills. And I just feel like I'm going to be in debt for the rest of my life. So I think it's, maybe that's a resource tool we can work on, like thinking about how to start talking to kids in a healthy way that doesn't, because one thing I've been really working on with myself is like, just because I exist in this healthcare system that sucks does not mean I am a burden. My life should not cost this much to live. And that's not my fault, that my family was in debt, that I'm in debt, et cetera, et cetera. So just kind of like touching on the mental health aspect of that question a little bit.
Yeah.
I think it's something that's really important to think about. And that's something we can take back to Youth Rally too, and think about how maybe we can support kids. I think we haven't done that before, but I think it's a good point.
Yeah. And the gottransition.org timeline that I posted articulates the importance of teaching your child about the healthcare system that they're living in and insurance, and how to, appeal denials and how to advocate for yourself. And I, again, would suggest that, like Jessica saying, starting that quite early.
It's a super important topic, and as a provider too, it took me 10 years to understand what insurance really was. And it still is quite confusing. And I think that's done on purpose, to be honest with you.
Yeah.
So I think as a healthcare provider, we should also work with patients. Maybe we have a role in kind of helping children who transition kind of think about these factors that are super important. So the second and last question is going to be, what are your thoughts about spiritual and religious counseling? What is the role of that for our children, our families?
I think that's a really great question. I was acting as a clinical social worker in the states of Texas and Oklahoma in the past 15 years, and also my internship at Sick Kids Hospital. I met a lot of people from various religious faiths and various backgrounds. And what I learned is that for a lot of people, it can be a great strength. For some, it can be really challenging at the time of diagnosis, depending on what the lessons are in their religious faith about disability and about differences. But I found that really emphasizing the strengths of every individual's spiritual faith and religious background in their care is really, really imperative. And so I included the chaplaincy aspect of the psychosocial partners in one of my slides. There's oftentimes interfaith spiritual providers in hospital settings. Oftentimes hospitals are open to inviting religious leaders into their institutions as well. And what I've learned from a lot of the younger kids that I've cared for from these various faiths is utilizing their religion has been really helpful, that, their God or their spiritual beliefs teach them that the being with bladder exstrophy is not a mistake. It's a beautiful experience, and they're made perfect the way that they are. And so I think that's a great question, and an area that we all oftentimes don't talk about directly because it's so unique and sensitive to each person. But I'm glad that that person asked.
I agree. I think growing up, it was an opportunity for me in our church. Even though I mentioned as a kid born in the 60s, I didn't know anybody else. Having youth groups and in our church, having that inclusivity was super helpful for that kind of belonging feeling. And then to mirror what you're saying, Emily, I completely agree. I think all of us innately understand the need to accept people of all different backgrounds and abilities, and our own exstrophy being such a something that's unique and different. That certainly acceptance of interfaith, different faiths is crucial to my beliefs.
I don't have an answer.
I do a little bit because I was raised Presbyterian, and I honestly, through some of the struggles and some of the unanswered questions I felt in that faith, became agnostic. And at the same time, I have so much respect and admiration for faith. And I absolutely agree, it has such an important place for many people. I do think my experience of that was sometimes feeling like church was a very like pitying place, was a very, sometimes in the church, everyone would know my medical details because we were putting in prayer requests, so I do think that there's room to be careful about how, faith is amazing, but how your kid is experiencing it, and then meeting them where they're at if they are having questions or doubts.
Yeah, and I think that speaks to how religion can be used as a strength, right? So there's something very different between pity and empathy. At Youth Rally, there are some individuals who are very open about their religious faith and their spirituality, and they are sort of so open to it that the other campers who have those belief systems sort of gravitate towards them, and they're able to talk about that. So I think Youth Rally is also a good place for people of all different various faiths to see it as a strength, not something that divides people.
Yeah.
Really good late night group.
Yeah. And we
Yeah.
have
Oh, yeah. They do a late night group. Yeah.
Yeah, and we have a lot of incredible spiritual leaders in our counselors. Many that are they're not all heathens like me. We have many that are great leaders for that.
It's just not us.
Just
Is that it? Okay. Thank you.